Good evening, everyone, and welcome. Thank you for joining us for our Frimley Health virtual members event. I'm Paul Henry, Public Governor for Southern Buckinghamshire, and I'm proud to chair the Trust's Community Engagement Group. This group meets to look at how we can better engage with you, our members, and the wider population. Tonight, we're going to talk about some of the important ways that we are working to continue improving the experience of patients. This work touches on one of our trust values, working together. But I'll let Lorna and Beth share more with you a little later. We're going to begin this evening with an update on our trust from our Chief Executive, Neil Dardis. This will be followed by a brief insight into how we are planning for the winter period with Chief Operating Officer Caroline Hutton. But first, let's take a few moments to reflect on events during the last few years, which have certainly been like nothing we've seen before. Since 2019, we've had a global pandemic and we've exited the European Union. We're into our third Prime Minister and fourth, though the fifth change of Health Secretary. We know that this has taken a significant toll on both those working within the health and social care system and, of course, our service users. Nationally, 35% more patients are waiting for more than 12 hours in our emergency departments than in 2019. And at the start of the pandemic, there were 4.24 million people on the waiting list for a consultant-led elective care. This is now over 7 million. There are 2.87 million patients waiting over 18 weeks for treatment. Just short of 402,000 patients waiting over a year for treatment. That's around 300 times the 1,300 people waiting over a year pre-pandemic in September 2019. And the median waiting time for treatment is now 14 weeks, significantly higher than the pre-COVID duration. Now, we can't fix the national pressures, but at Frimley Health, we're committed to excellence. And we believe in working together to improve where we can, so that our patients have the best possible care and the best possible experience that they can get. Our speakers tonight will take you through some of the ways that we're going to do that. There will be a chance to ask questions, but please wait until the end to ask them. If you want to ask a question, please use the raise your hand button and you will be asked to contribute. Before I hand over to Neil, though, there is an important introduction that I'd like to make. Please join me in welcoming Sarah Peacey, who is not only chair of our Patient Experience Group, but I am delighted to announce that she is also our new lead governor. I'd like to invite Sarah now to say a few words. Sarah.
Thank you very much, Paul, for that very warm welcome. I'm sorry, I don't know if my camera's working, so please forgive me. Yes, so good evening, everyone. It's really terrific. It's a huge privilege to be a governor and to be a lead governor, especially. Really, the focus for this evening is about patients being encouraged to actively participate in their own care. It's hugely important in getting the right care and support for the individual and their families. And governors can support this initiative in a broader sense by representing the interests of patients, members and public to the board. I've been involved with the Trust since 2015, and as Paul has outlined, the pressures now on the NHS mean some decisions the Trust have to make are undoubtedly harder. So prioritisation is key. As governors, we have a very positive and collaborative partnership with the board, and they welcome input on our engagement with you because it can help shape their decisions in your interests. So a very important part of our role is to listen to your views local views in the ICS, and combine that with some wider knowledge in discussions with the board. As lead governor, I will champion the patient's voice and really welcome the initiatives that you will see this evening. Please do feel free to contact me or your local governor with your views. So it's with great pleasure I now hand over to our terrific Chief Executive, Neil Dardis. Thank you, Neil.
Thanks, Sarah. And thank you, Paul. Good evening, everyone. Thank you so much for joining us this evening. I'm going to provide a bit of an overview of the organisation in terms of something that makes us up and how we're doing at the moment and some of our plans for the future before I hand over to some more of our colleagues. So I guess a quick pen picture of our organisation. We're quite a large, complex organisation by NHS standards now. We've got something in the order of about 12,000 staff. We serve a catchment population of about 880,000 people, and we've got a turnover of about £900 million a year. We serve our populations predominantly through our hospital sites, so that's Wexham Park in Slough, Heatherwood Hospital in Ascot, and Frimley Park Hospital in Camberley, but also through a range of satellite sites in Windsor, Maidenhead, Fleet, Farnham and Aldershot, and other areas, and increasingly in patients' homes. We now provide a full range of district nursing and rehabilitation services in the southern end of our patch, as well as our specialist services that we provide through our acute hospital sites. So we're quite a large, complex organisation now, and it's phenomenal to think about the number of lives our teams will touch on each and every day. Each day we see over 700 patients through our accident and emergency departments. We serve over 4,000 meals to patients in our hospital beds and support over 2,500 patients through our outpatient departments as well. So think about the number of lives impacted on over the course of a year and the families and loved ones for whom that's a really important event as well. So we're never in any doubt that the importance of the role our services play to our local communities. Next slide, please, James. So we've got some ambitious plans here at Frimley, and we're about midway through our 5-year plan. And that set out a clear vision to be a leader in health and wellbeing, delivering exceptional services for our local communities. And that vision was underpinned by our 3 values: committed to excellence, working together, and facing the future. And those 3 values absolutely drive everything we do. And they support our 6 strategic ambitions: improving quality for patients, ensuring wherever patients access care, they receive the same high standards of outcomes, experience, and the highest levels of safety. Supporting our people to be one of the best employers in the NHS, ensuring our staff feel valued, supported, and able to meet their own aspirations. Collaborating with our partners, recognising that our patients expect and should get joined up care across the whole of the health and care sector. Transforming our services, making sure that wherever care is provided, it's of the highest standards each and every time. Making our money work, recognising that the public finances are going to be challenged moving forward, and that we ensure that we invest every single element of our resources in the best possible way. And advancing our digital capability, ensuring that our patients and our staff have access to the best in technologies and the latest advances in medicine. Now, we've obviously been significantly challenged, as Paul described, over the first couple of years of that ambitious plan with the impact of COVID and the pandemic. And I and the board and our governors are incredibly proud of how our staff supported our local communities through that incredibly challenging time. But equally, we're really proud that we've kept the most significant planks of our strategy on course by building and opening the fantastic new Heatherwood Hospital in Ascot, a £100 million planned care facility, one of the best facilities in the NHS in which our patients are treated. And just a few months ago, going live with our new electronic patient record, where we were able to combine over 260 clinical applications into one IT system, supporting our staff to provide an improved care, but also empowering our patients far more in the care that's provided in the future. We've equally embarked on a new quality improvement programme called the Frimley Excellence Programme, where we build the capability and capacity amongst our teams to deliver the improvements they want to make. And with our partners, we've developed our integrated care system that Sarah alluded to, where we're really enshrining the new statutory obligations that are set out in the NHS to work far more cohesively with all of our partners across the health and care sector. So we're really proud that we kept those clear milestones in place. Next slide, please, James. But equally, as Paul and Sarah outlined, we recognise that there are significant challenges across the NHS at the moment. And I would like to personally apologise to anyone who's waited longer than they should have had to, or not received the standards that we would normally expect to provide, recognising those challenges that are in place at the moment. Like much of the NHS, we're seeing huge challenges across the urgent care pathway, which is really causing, we know, extended waiting times for many patients looking to access urgent care, and significantly numbers of patients who aren't able to be discharged back to their usual place of care because of the challenges around capacity in the social care sector as well. We recognise, like is seen over most of the NHS, waiting lists have grown, and our patients will be waiting longer than we would want them to for many elements of planned care. And we recognise the NHS is going to be significantly challenged from a financial perspective as we look to recover on many of those services and meet the obligations while still operating in a COVID environment. So we see those challenges as well, and we're working incredibly hard to tackle many of those, trying to ensure that our patients are directed to the quickest form of urgent care that they can be, so we can treat them as quickly as possible through the right specialists. Making the most of our Heatherwood Hospital to really expedite treatments and ensure that we're as productive as possible so we can reduce waiting times for our patients. We're working incredibly hard to be one of the best employers in the NHS, employing hopefully over 2,000 staff this year, who will then be able to provide the care that our patients need, and ensuring that we work across every part of our organisation to be as efficient as we can possibly be, so we do make the most of each and every resource that we have, so we can invest it in improving care for our patients moving forward. And as will always be at the heart of everything we do here at Frimley, first and foremost, it will be about continuing to drive improvements in quality so that our patients do receive the best experience and the highest levels of safety. And you're going to hear more about that from our teams as we move forward this evening. Next slide, please, James. But I also want to reflect on many of the improvements that our staff continue to make, even in some of the most challenging times the NHS has seen. We're really proud of our community teams who are seeing more patients than ever before. Over 400 patients since April have received access to a 2-hour response time. Rather than having to attend hospital and potentially be admitted, we've been able to deploy our specialist nursing and at times our consultant teams to support those patients to remain at home and lead healthier lives. We've also seen significant improvements in our maternity services, such as our Mamas line, which is a 24-hour response service to women who may be concerned about the progress of their pregnancy or unsure about their potential in moving into labour, ensuring they receive the support that they need. We developed one-stop services in areas like prostate cancer, significantly reducing the time for diagnosis of those conditions, so patients can be treated more quickly. And our staff continue to do amazing things every day and receive awards for that, such as our neonatal service receiving the Bliss Platinum Award, or indeed Dr. Tote, our clinical lead for intensive care, who's recognised as one of the significant clinical leads nationally. So we're really proud of all the work that our teams continue to do. And even despite some of the challenges, which we recognise and we're working on, I want to make sure that we continue to promote the great work of all of our teams. Next slide, please, James. So looking to the future, it's important that we continue to be accountable to you, the communities we serve, in driving the improvements that we want to make. We know it's a challenging time for the NHS and it will continue to be over the coming couple of years, but we continue to strive to meet the ambitions that we set for 2025. We want to be one of the most digitally advanced organisations in the NHS. Our electronic patient record will take us a huge way towards achieving that. We want to continue to work with our staff and with our patients to make sure we make the most of that investment. We want all of our services to be recognised the best they can possibly be, and with the Care Quality Commission the next time that they come to inspect our services. We want to continue to strive to be one of the best employers in the NHS, helping our staff to be the best they can be, recruiting and retaining the highest quality staff, and showing our appreciation and value for everything that they do. We want our local communities to be able to access the latest advances in medicine, such as our robotic surgery programme, or access to our specialists, cardiovascular and hyperacute services. And we want to play our part in one of the best systems in the NHS, working collaboratively with all of our partners across the health and care sector to support our communities to lead healthier lives. So that's a really ambitious plan. I know it's ambitious, but that's what we think our Frimley communities deserve. And we're going to say a bit more now over the coming minutes around some of the things that we're doing to make those a reality. So let me now hand you over to our Chief Operating Officer, Caroline Hutton, who's going to talk about some of our immediate plans for the coming weeks and months. Over to you, Caroline.
Thank you, Neil. Good evening, everybody. As Neil says, I'm going to talk to you this evening about how we're getting ready for winter. And as you've just heard from Neil, we have been in a very challenging year. More so than ever, it's really important that we prepare well for winter. And we've been preparing for some time. Next slide, please, James. So our focus is on 3 key areas for winter. We want to reduce the pressure on urgent and emergency care as much as we can do. We want to maximise the capacity that we've got within the hospital, ensure that we're making best use of our bed capacity, and support the ambulances as they're under a lot of pressure as well. And then thirdly, we want to maintain efficiency and flow. I want to reduce the time that patients have to stay in hospital and make sure they get home as quickly as they can. Next slide, please. So just to go into a little more detail on those, the first area, reducing pressure on urgent and emergency care. So we've got a renewed focus on our emergency department waits. The departments are putting in improvement plans all the time and really focusing on trying to keep those waits down through the winter time, which is very challenging when they're under so much pressure. So we've developed optimal care pathways. We've got GP streaming services at the front door, helping us to ensure that those patients who can be seen by primary care are seen and streamed to primary care at the front door. We've got 24-hour assessment units and areas where patients can be rapidly assessed and then turned home with support if appropriate. And that includes access to frailty services, surgical and medical specialties. We are fast tracking some of our conditions so that with clinical criteria supporting them, we can assess them and support them to go to the appropriate areas so that we reduce the number of people in our emergency departments. We're using technology to virtually support patients where it's safe to do so they can avoid having to come in at all. So we can send patients home and we can remote monitor them, and that can be supported also by primary care. And we're reviewing the winter rota to increase the number of doctors that we've got working at weekends and over the peak periods during Christmas and the winter months. Next slide, please, Jane. And then what we're also trying to do is maximise the system capacity that we've got, the hospital beds that we've got. We haven't got an abundance more beds to open. So it's about really making use of the beds that we've got and trying to create some capacity in the community as well with our system partners. So reviewing the infrastructure, escalation areas and the bed models that we've got, and making sure that we try and keep people in the right beds at the right time so they have the best chance of getting the treatments rapidly and getting home quickly, so that we maintain efficiency and flow and we reduce our sort of long medically fit patients and how long that they have to stay in hospital. Next slide, please, Jane. And then in terms of winter resilience, so we do need to make sure that we really keep a grip and traction on everything that's going on in the hospitals during this time. And so we set up trust operational centres. We're also working closely with our system partners, and they have system operating centres. And we're going to be collaborating and working together on ensuring that we're all focused on what's going on in the hospitals and where the pressures are, and then helping across the system together to unblock those pressures as they occur. We'll have hospital command and control activated processes in place, and we will release staff to support clinical areas as needed. We've got escalation policies in place, including for COVID, flu, RSV, and for occupancy, where we get occupancy pressures, so that we can escalate and staff can escalate. We can all be involved in helping to fix those problems as they occur. We're looking at rotas, as I say, and making sure that clinically and operationally leaders and staff are all in the right places as they need to be. And we're ensuring that we've got winter packs in place for the most vulnerable patients. And some of that's been sponsored by our Frimley Health charity. Next slide, please, James. And we've got something what we're calling Everyday Matters happening this winter, and we've been working on throughout the year, actually, particularly the latter part of the year. And this is about ensuring that our patients are have a rapid discharge process and can get home to either their homes or their care homes as rapidly as possible and don't have to spend any unnecessary time in the hospital. So everybody's working on this. It's a very big focus for the whole organisation. We're working with our partners across the community to help patients get home quicker and get the care that they need. We're working with redesigning the system to ensure that patients get the care rapidly and more quickly. And we're improving our practices in the hospital to make sure that the discharges are more efficient and so they can get home quicker. And we will be doing some exercises before winter and probably going through the winter to ensure that we practice that and keep improving the processes as we go. And we've got regular checks in place for all of that. So we'll be doing our daily performance checks and monitoring our ED performance and our ambulance handovers. We'll be ensuring that patients' discharges are monitored. Patients are moved to discharge lounges very quickly so that capacity is freed up for patients who are in ED that need beds and acute care. And that we've got our trust operations centres overseeing all of that. Next slide, please, James. So how can you help? So we all can do our part here. Obviously, the very first thing to think about is to get your flu and COVID vaccinations if you haven't already, and protect yourselves and protect the loved ones around you from transmitting those infections. Make sure that your medicine cabinet is well stocked with cold and flu remedies, and be sure to make sure that your prescriptions are all up to date and that you get those ready for the winter time. Take steps to stay warm and hydrated throughout the coldest weeks, and make sure that we're looking out for vulnerable neighbours, friends and family through what's going to be quite a difficult winter, I'm sure, for everybody. Next slide, please, Jane. So I'm going to hand over to Lorna Wilkinson now, our Chief Nurse for Nursing and Midwifery, and then take some questions later. Thank you.
Thank you, Caroline, and good evening, everybody. My name's Lorna Wilkinson. I'm Chief of Nursing and Midwifery, and within my portfolio I have allied health professionals as well. And I wanted to be very specific about that because you're going to hear from one of them tonight. So our next session is very much centred on the patient experience of care and how we want patients to work in partnership with us in taking active decisions on treatment and care. And I would really stress that we're now moving into the medium and long term. I see this as a real change in how we partner up between professionals and patients in how best to deliver care to our local populations. So to take us through this, I'd like to bring in Beth and Sylvia, who will introduce themselves. And I'm very, very grateful to both of them because they are absolutely passionate on this subject, and I know will deliver it better than I could ever attempt to. So over to Sylvia and Beth.
Hi, thank you, Lorna. So I'll start by introducing myself. So I'm Bethany Ball, and I'm really proud to say that I'm Head of Quality and Clinical Effectiveness for Frimley Health. And I look after our clinical audit programme, look after our NICE guidance programme, making sure that we are doing everything we can to implement best practice. And with that, I will hand you over to Sylvia, who will start our presentation. Thank you.
Thank you, Beth, and thank you everyone for inviting me to come along and speak to you all tonight. So, as Beth said, my name's Sylvia and I'm the lead advanced practice physiotherapist across the Frimley Trust, and I also look after the MSK pathway for our Frimley ICS system. And I'm going to do a little bit of setting the scene really around shared decision making. And James, I don't know if it's my camera, but I can't see the slides. Is it just at my end? If not,
Sylvia, we've got lots of decision making slides.
Okay, that's fine. I can talk through them. And so I am really passionate about shared decision making, and I think, you know, all health professionals generally are, but I think as somebody who's got a long-term condition, I know that I've experienced both good quality conversations, but sadly at times I think those conversations could have been a little bit better about really involving me in my care. So next slide, please. So healthcare is continually evolving, and just like healthcare continually evolves, so do our conversations. And you can see that, you know, often we have, or certainly in the past, it used to be that somebody would be told, this is what your problem is, and this is what I'm going to prescribe. Sadly, we have, so thankfully rather, I should say, we've moved on from that. And although we had that middle section where we had this is what's going on with you and here's some information, what we really want to ensure is that every conversation we have is really about this is what's going on from a medical point of view, but what really matters to you? What is it that you can't do? What is it that you'd like to achieve from this? And actually, out of all the treatment options that we've discussed with you, do any of them sound like they would be suitable for where you are at your particular time of life or what life events are going on? And that includes doing nothing at times. So it's a really collaborative process so that we ensure that we get the best outcome for you as the individual. Next slide, please. Now, as I can't see the slides for some reason, I think we're on the one that sort of really just sort of is the one that sort of says that we really want to encourage you to ask us each time about what it is that your options are, what might happen if you did nothing, what, you know, if you did go down that option, what sort of is the outcome? How long might that take? And really be an active part of that. And Beth will go into some more detail shortly about what we're planning to do in the future. Next slide, please. So it's really important for you to realise that there should be no decision about you without you. So we know that surgery doesn't always give everyone a better quality of life. And in fact, a recent survey in England has actually reported that 1 in 7 patients will have some post-surgical regrets. And that's quite a significant number. And I wonder whether everyone's had those conversations to understand what that surgery involved. So that's why it's really, really important that not just for surgery, but for any treatment, that you ask us questions about what does this treatment option mean for me? And obviously, if I talk about musculoskeletal, which is my area, so if we think about sort of knee arthritis, we know that if you polled 100 people and did an exercise program, 47 out of those 100 people would get better by exercise alone. If they did go on to have something like a total knee replacement, 75% of them would be much better out of 100. But we do know that 19 out of 100 would have some ongoing stiffness. Now, for some people, that might not be a problem, but for others, it's going to be potentially a significant problem. If you're keen to kneel down, do gardening, things like that, that can be a problem if your knee replacement doesn't allow you to do that. So that's why it's really important to ask us those questions. And I think this is my last slide. Next one, James, please. This is hopefully the slide that you can see that I can't, is the one that talks about, you know, we can have the same level of information. So you could have a potentially sort of a life-threatening problem or a serious condition, and NICE guidelines might come up with two treatment options. One would give you, potentially sort of a cure, and then the other one, one could give you an extra year, but really good quality of life, and one could give you maybe a 50-50 chance of kill or cure. Now, each of us are going to make a decision as to which one we're going to go for. We can't assume that we're all going to make the same decision, because we've all got different values. And I think, if I'm remembering my slides correctly, if I hand on, it will be Beth next.
You're right, Sylvia. Thank you.
Yes.
So I wanted to start by saying a huge thanks to Sylvia, because I met Sylvia when I was doing my Frimley Excellence Green Belt training, and it was at a time when I had just read all the literature on shared decision making and was looking at the extensive NICE guidance on it and thinking, goodness me, this is a real cultural change that we need to embed right across the organisation in everything we do, so we are truly partnering with our patients around decision making. And from that meeting, really, I was able to understand more about shared decision making and see that there were really pockets of excellence in terms of practice in our organisation. And Sylvia has helped with the first action that we decided to take to bring this into the organisation, and that was really to set up a steering group. And I'm really pleased to say we've got a number of clinicians on the group now. We have specialist nurses on the group, supported by our lead governor, Sarah Peasley, as well, and also ICS colleagues joining us. And we've got specialties in terms of vascular, cardiology and maternity, just to start off with. So that's really important, because that's going to help us create an energy in the organisation. We're going to be able to have champions within specialties to really promote shared decision making and really kind of guide how we're going to embed this into the organisation. So we're going to be focusing on educating all of our clinicians, nurses, around what shared decision making really means, providing resources and support for them so that they can learn about it, and also have some practical guides as to how to conduct these conversations. And this might vary from our e-learning from health programmes, or from experts like Sylvia, who has agreed to go down to some of our specialties and do some coaching with them about how to bring shared decision making into their practice. So education really is one of the key areas we'll be focusing on. We'll also be working together with our ICS partners to look at, when we're redeveloping patient pathways, to bring shared decision making very early into that pathway and right through the journey. So really looking forward to those opportunities. And as you can hear, some of the decision making that Sylvia was talking around in the MSK pathways, some patients' outcomes may have been very different had they perhaps had other opportunities of choices. We'll really be working together to with our patients to, I suppose, help educate them about what shared decision making is for them and their role within it. We'll be very much relying on shared decision making tools, and these are tools that really present options and risks in a very different way to patients, and also hopefully in a more diverse way, because our population is very diverse and we need to think about alternative ways to share information and support decision making. We are starting with our outpatients transformation programme, and you'll see here a lovely poster which we're going to start seeing everywhere in our outpatient departments on our website, and we'll be talking about it's okay to ask. So really encouraging patients before they come to their appointment to think about some of the questions they might want to ask their healthcare team when they attend. There'll be some narrative in our outpatients letters to describe this for patients so that they can prepare before they come. And we're really hoping this will help drive improvements in the quality of the consultation that takes place. We will be looking at making sure that we measure our success with this. We're hoping to also have a survey of how patients found their conversations and their role within that decision-making process. So we'll be rolling out a survey in December for all patients who will be attending an outpatient appointment. Next slide, please, James. And it's not just outpatients, so we'll be looking to really bring this level of practice into everything we do every day. Caroline talked about our Everyday Matters programme earlier, because everybody in the organisation has a role to play with Everyday Matters, from our healthcare assistants who support our patients to be more independent with washing and dressing, eating and drinking, to the nurses on the ward who will help patients understand about the different medicines that they're on and options. And we're really going to be encouraging patients through shared decision making, and it's okay to ask, to really ask those questions about, you know, when am I going home, you know, or what can I do to help with that sort of process. So yeah, every step of the way we're hoping to get patients to really step up, feel like they're really important and can ask these questions when they need to. I think that's it from me. Thank you.
Yesterday afternoon, I was privileged to spend some time in the emergency department at Wrexham Park Hospital, talking to staff and patients. And just to put it in context, the emergency department was rammed full yesterday afternoon because it's a Monday, and everyone was really, really busy. But the thing that struck me was the calmness that was in the whole department, both front of house and in the actual ED itself. Everyone was frantically busy. No, frantically is the wrong word. Everyone was really busy, but with a calmness and an assuredness that was very welcoming, I think, to someone who doesn't go there very often. I was very pleased with that experience, and we owe these people in not just the ED department, but in the whole hospital, as patients and members of the trust, our thanks for going through what has been a terrible 2 years, COVID, and now the winter pressures facing us. But they do it with love and they do it with fortitude, and we all owe them thanks for that. Anyway, thanks for coming this evening. We enjoyed having you. We enjoyed showing our wares to you, and we trust that when you go away, you have a lovely evening. Thanks very much and good night.